Whether you're an athlete, a weekend warrior, or just someone who wants to maintain mobility and comfort as you age, keeping your joints healthy is absolutely essential. We're going to explore actionable advice on maintaining joint health, including exercise, supplements, peptides, and even lifestyle changes to prevent and manage joint pain. Maintaining your joint health is not just about avoiding pain, it's about preserving mobility, independence, and your quality of life. When joints are healthy, they allow for a full range of motion without pain. However, there's various factors that can impair joint health, including Hello and welcome back to the Ultimate Human Podcast. I'm Gary Brecka, and today we're diving into a crucial topic that impacts many aspects of our daily lives: joint health. Whether you're an athlete, a weekend warrior, or just someone who wants to maintain mobility and comfort as you age, keeping your joints healthy is absolutely essential. So we're going to explore actionable advice on maintaining joint health, including exercise, supplements, peptides, and even lifestyle changes to prevent and manage joint pain. This episode is science-backed with insights drawn from leading journals and articles to ensure you get the most accurate and practical information. Understanding joint health begins with recognizing the role joints play in our bodies. Joints facilitate movement and structural support. When joints are healthy, they allow for a full range of motion without pain. However, there's various factors that can impair joint health, including aging, sedentary lifestyle, poor diet, and injuries. Maintaining your joint health is not just about avoiding pain, it's about preserving mobility, independence, and your quality of life. To appreciate joint health, it's essential to understand the basic anatomy of the joint. Joints are connections between bones, allowing for movement and for support. They consist of several components. First, cartilage, a smooth rubbery tissue that's covering the ends of bones and joints, which helps to reduce the friction. There's also a fluid in there, in the synovium. This is the lining of the joint that secretes synovial fluid, the lubricating fluid in your joints that reduces wear and tear. And then we've got ligaments. These are tough bands of connective tissue that connect bones to other bones, and they really provide stability. And then finally, you've got tendons. These are fibrous cords that attach muscles to bones. Remember, the difference between a ligament and a tendon is a ligament connects a bone to a bone, a tendon connects a muscle to a bone. So these are meant to facilitate movement. Over time, wear and tear, injuries, or inflammation can damage these components, and it leads to joint pain and disorders like arthritis. Actionable steps for maintaining joint health would include the following. Number one, guys, is regular exercise. And you do not have to go super intense on your exercise, but exercise is one of the most effective ways to actually maintain joint health. In fact, as you were growing, you grew the most during your teenage, pubescent years while you were the most active. It strengthens the muscles around the joints. It helps to maintain bone density. Remember, bones do not strengthen unless they're loaded. Muscles do not grow until they've been stressed. So they maintain bone density, they enhance flexibility, and also our balance. So here are some joint-friendly exercises. Low-impact aerobic exercises. These are activities like walking, swimming, and cycling, and these can improve not only your cardiovascular health without putting undue stress on your joints. We know that building muscle strength around the joints can actually provide better support and reduce the strain on the joints. In fact, professional sports are infamous for strengthening the muscles to protect athletes' joints. Focus on all major muscle groups, including legs, back, and your core. There are flexibility exercises. Stretching exercises like yoga and Pilates can improve joint flexibility and range of motion. These activities also help reduce stiffness and improve overall mobility. A study published in the journal Arthritis Care and Research highlighted that regular physical activity reduces the risk of developing osteoarthritis and other joint-related issues. Remember that your diet plays a crucial role in maintaining joint health. Here's some dietary tips. Anti-inflammatory foods. Remember to incorporate foods that are rich in omega-3 fatty acids, such as salmon, walnuts, and flax seeds, because these actually help to reduce inflammation in the joints. If you think about antioxidant-rich foods like berries, leafy greens, and nuts, these are packed with antioxidants that can also protect your joint tissues from damage. When we look at calcium and vitamin D3, these are essential for bone health. These nutrients can be found in dairy products, leafy greens, and fortified foods. Vitamin D3 actually helps the body absorb calcium more effectively, and if you supplement with vitamin D3, you should always make sure that your D3 supplement has K2. something called vitamin K2. This acts as a calcium transport molecule, but it has an affinity for the bone and not the arterial wall. Research from the National Institute of Health suggests that diets high in antioxidants and anti-inflammatory foods can significantly reduce joint inflammation and reduce joint pain. When you're maintaining your weight, a healthy weight is critical for joint health. Excess body weight puts additional stress on weight-bearing joints, such as the knees, hips, and the spine. Even a small amount of weight loss, as little as 5 or 8 pounds, can relieve pressure on your joints and reduce the risk of joint damage. According to a study from the Cleveland Clinic, every pound of weight loss results in a 4-pound reduction in the load exerted at the knee joint. So just think about that next time you want to embark on a weight loss journey. There are several supplements that have been shown to improve or support joint health. Glucosamine and chondroitin. These are natural compounds found in cartilage, and studies, including those referenced by Harvard Health, have shown that they can help reduce joint pain and improve mobility in people with osteoarthritis. Turmeric and curcumin, these are two of my favorites. These are known as anti-inflammatory properties, and turmeric can help reduce joint pain and reduce joint stiffness. Those of you that wake up in the morning stiff and achy, like you had a workout the night before, when you haven't, you may really want to look into a good turmeric curcumin supplement. There was a study published in the Journal of Medicinal Food, and it found that curcumin was as effective as some anti-inflammatory drugs at reducing joint pain. Collagen is another one. This is a protein. Now remember, collagen that you ingest doesn't necessarily show up as collagen in the body, but this protein can help maintain the integrity of cartilage. Proteins break down into amino acids, and amino acids are the building blocks of cartilage. Some studies suggest that collagen supplements can help reduce joint pain and improve symptoms of osteoarthritis. Hydration is also maybe one of the most overlooked aspects of all of joint health. Staying well hydrated is essential for your joint health. Synovial fluid, which lubricates the joints, is primarily composed of water. I like to add a pinch of something called Baja Gold, which is a mineral salt, to my drinking water. This way you actually don't get dehydrated by demineralizing the body. Dehydration can reduce the amount of synovial fluid, leading to increased friction and joint pain. Calcium and vitamin D3 are essential for bone health. These nutrients can be found in dairy products and leafy greens, and in non-fortified foods if you take a supplement, vitamin D3, along with a supplement called K2. Remember, try not to take vitamin D3, which is the cholecalciferol version of vitamin D, and take it with vitamin K2. Make sure that those two supplements are integrated, because D3 acts as a calcium transport molecule, and it also helps to deposit calcium into the bone and keep it out of the arterial wall. Remember, it does help absorb calcium more effectively. Hydration is probably the most overlooked aspect of all of joint health. I like to hydrate with a little bit of Baja Gold sea salt, but remember, a well-hydrated joint is a healthy joint. The synovial fluid, which lubricates joints, is primarily composed of water. Dehydration can actually reduce the amount of synovial fluid, leading to increased friction, and this is what causes joint pain. So aim to drink at least 8 cups of water per day, preferably hydrogen water, and preferably once a day, adding Baja Gold sea salt, which is a mineral salt, to your drinking water. If you drink 8 cups of water a day, more if you're actually physically active, you're going to notice the lifestyle changes and the reduction in joint pain. Another thing that we want to do is avoid prolonged inactivity. Believe it or not, inactivity decreases our joints' mobility and increases our likelihood of joint pain. Staying in one position for too long can lead to joint stiffness and also to pain, so make it a habit to move around or change positions regularly, especially if you have a sedentary job. I do this on flights all the time, especially flights that are over 2 or 3 hours domestically or any international flight. I get up, I make sure that I do simple stretches or short walks, sometimes some body weight air squats, or just pace the aisles of the plane. Don't even worry about what your passengers think about you. There are ergonomic adjustments that ensure that your workplace is ergonomically designed to reduce joint pain. This includes having a chair with proper lumbar support, a desk at the right height, and using tools that minimize repetitive strain on your joints, like desks that elevate and reduce their height so you can stand some of the day and sit some of the day. Absolutely quit smoking. We know that smoking has been linked to increased inflammation and reduced bone density, both of which adversely affect joint health. So quitting smoking can improve blood flow to the joints and reduce the risk of conditions like rheumatoid arthritis. So managing joint pain, even with the best preventative measures, joint pains can sometimes occur. Here are some strategies to manage it. One of my favorites is hot and cold contrast therapy. Applying heat, which relaxes the muscle and improves blood flow, followed by cold packs, which reduce inflammation, numb the area, and decrease the blood flow. This vascular vasodilation and constriction is excellent for joint pain. You don't need to have a sauna and a cold plunge. You can simply use contrast therapy in your own shower, or you can use hot and cold packs. Pain relievers like over-the-counter medications like acetaminophen and NSAIDs can help manage pain and reduce inflammation. However, I do not recommend personally that these be used, and if they are used very, very sparingly and only under the guidance of a healthcare provider. There is now studies linking some of these anti-inflammatories to decreased mobility in the joint and increased pain over time. The more natural you can stay with your remedies, using things like physical therapy and exercise, hydration, the better off you'll be in the long term. Physical therapy is also a tailored approach. Good physical therapists can exercise and treat joints to improve their range of motion and their function and reduce their pain. So for those of you that are looking to take their joint health to the next level, consider potentially using a physiotherapist. Biofeedback and monitoring are devices that can help monitor joint stress and recovery. These devices provide real-time feedback, and they allow you to adjust your activities and prevent overuse and promote recovery. Using biofeedback devices can help monitor joint stress and recovery. These are devices that give real-time feedback, allowing you to adjust your activities and prevent overuse and promote recovery. There are also treatments like PRP, platelet-rich plasma, and stem cell therapies, which have come a long way in the last 10 years. Platelet-rich plasma and stem cell therapies are emerging treatments that can potentially enhance joint repair and reduce pain. The key point here is joint repair. They are actually pro-repair of tissues. These therapies involve injecting concentrated platelets from your own body or stem cells from someone else's body, usually from the umbilical cord or the placenta, into the affected joint, and this promotes healing and does help with inflammation. Maintaining joint health is a multifaceted approach, and it includes regular exercise, balanced diet, weight management, hydration, and lifestyle adjustments. By implementing these strategies, you can significantly reduce your risk of joint pain, other disorders, and maintain your mobility and quality of life as you age. And after all, isn't that kind of what it's all about? Remember, small changes make a big difference in your joint health. Start incorporating these tips into your daily routine today, and your joints will thank you tomorrow. Thank you for joining me today on the Ultimate Human Podcast. If you enjoyed this episode, please subscribe, leave a review, and share it with your friends. And until next time, remember, that's just science.